একটাই দেশে বেশি অভ্যাস আছে।
And ma'am, before starting, if I receive any questions, I will put all those questions in the chat box. Thank you, ma'am. A very good evening. A very good evening and warm welcome to all the dignitaries present here. I am Momita from Planet, serving as the allocated station assistant to ensure a seamless experience. Planet stands as India's most relied upon digital platform offering a multitude of enriching services exclusively for doctors. It is with great pride that Planet serves as the digital partner for this event hosted by the National Neonatology Forum, and the focus of today's session is the NNF Shine Week 2 East Zone. So without any further delay, let's begin to the session for which I would like to invite Dr. Rashna Das Hajarika ma'am to take over. Over to you, ma'am.
Thank you so much, Momita. I think you can hear me, no?
You are perfectly audible, ma'am.
So thank you to NNF for giving me the opportunity to talk on a very important topic today for our participants. Can you see my slides?
Yes, ma'am. Can you please make it full screen?
Yeah, I've made it full screen.
No, ma'am, not yet.
Can you see it moving? No.
No, it's not moving, ma'am.
Just a minute.
It's moving, but it's not full screen, ma'am.
One second. Huh?
Sure, ma'am. From the beginning, yes, ma'am.
Now?
Now, it is taking time. No, not yet, ma'am. Oh,
Try again.
yes, reshare, please.
Can you see now?
And no, ma'am, it's not full screen yet. Okay, no issues, ma'am. So you can continue. You can go ahead.
See if it's moving or not.
It's not moving, ma'am.
Now? Not moving?
Not moving, ma'am. Actually,
it should not happen like that. No, it should move. One sec.
ma'am, you can do one thing, ma'am. You can convert it in PPTX. Would that be possible?
I'll just try once more. Okay.
Okay, sure, ma'am.
Can you see now?
Ma'am, it is taking time. It's showing that you have started the screen sharing, but PPT is not visible on the screen.
Why is it showing that your screen sharing is paused?
Ma'am, there is no issues from our end, ma'am. Still, I'm checking. Ma'am, the network bandwidth can be low, ma'am.
No, my bandwidth is fine. Now?
Ma'am, perfect. Please go ahead, ma'am.
Sure. Thank you. So very sorry for that little problem. Thank you so much. And today we are discussing a very important topic, that is breastfeeding. So these modules, I think, have already been shared with the students. And today I'll just be going through some very important points related to breastfeeding. So we know that breast milk is the optimal nutrition for the newborn baby. And there are many reasons for this. We will be discussing that later on. What is very important to understand is that exclusive breastfeeding can prevent 13% under 5 deaths worldwide every year because of the various benefits that breast milk offers to the baby and the newborn infant. It is said that if you initiate breastfeeding within the first 1 hour of birth, that is in babies who can breastfeed, or even in fact give express breast milk to those babies like preterm babies who cannot suck initially, then that itself, if you do that within the first 1 hour, will reduce 22% of all neonatal deaths. So Government of India has launched a program known as Mother's Absolute Affection, or the MA program. And this has been done to create an enabling environment to promote and support breastfeeding in India. Now, a very basic thing like breastfeeding, why did we have to go for a MA program to enhance breastfeeding? Now, there are many reasons for that, because till even now we have a lot of challenges, and these challenges have to be overcome, because otherwise we will be in a pathetic position as far as breastfeeding is concerned. The NFHS data, NFHS 4 survey done in 2015-16 revealed that only 41.6% of the babies were breastfed within the first 1 hour of birth, and only roughly about 55% of children under 6 months of age were exclusively breastfed. So this is quite shocking. And these figures, I'm telling you, have not changed even today. So in order to improve, we are doing this topic today so that you as postgraduate students can give the right kind of advice to the mothers when you are counseling them. So the learning objectives for today would be to enumerate the advantages of breastfeeding, help mothers with the correct technique of breastfeeding. Now, this is important because initially what used to happen, people used to be living with joint family with a lot of aunts and a lot of other relatives who would help the mother to breastfeed. But these days, because of the nuclear family, so that support from the other family members has been taken away. And it is very important that we as medical professionals, and especially pediatricians, we have to help the mothers know what is the correct technique of breastfeeding. Then we need to identify factors which will enhance lactation, because many mothers complain that they do not have enough milk. Try to identify difficulties which are associated with breastfeeding and what is the solution that we can provide to the mothers, and also help mothers in doing the proper way of doing or expressing the breast milk. Advantages of breastfeeding, I'm sure you've read in your MBBS days also that there are 3 main advantages. One is for the baby, second is for the mother, and third is for the family and the society. So there are a lot of advantages of breastfeeding to the baby. First and foremost is the nutrition. So breast milk is unique for each baby, and it is unique also for gestation. So a preterm baby, mother's milk, mother who has delivered a preterm baby will have a different milk composition, which will be more protein so that the baby grows well, compared to another baby who is a term baby. So it is very unique for each baby, unique for each gestation, and it provides the optimal growth and nutrition for the development of the neonate. It protects against infection. We know that this is the first immunization of the newborn baby. I'll be showing you in a little bit of detail what exactly happens. Then it is easily available at the appropriate temperature, because it will go at the body's temperature, that is about 37 degrees centigrade. So you don't need to boil it, you don't need to warm it. The composition is such that it is easily digested by the baby, and it also protects against allergies, which include eczema and asthma. There is an emotional bonding which is established the moment the mother starts breastfeeding the baby. The other important part is the moment you put a newborn baby who is born from a sterile environment, you put the baby to the breast, it comes in contact with the mother's skin, and the good bacteria from the mother are transmitted directly to the skin of the baby. And when the baby sucks on the mother's breast, it also takes the good bacteria inside the gut. This is also said to prevent allergies in future, as well as it helps in the development. There are some ways it helps in development of the brain. And hence these breastfed babies from various studies have been noted to have an IQ which is at least 8 to 10 points higher than those babies who have not been breastfed. So this is a very important way. This IQ factor is a very important way, or you can use this knowledge to, in fact, influence the mothers to breastfeed the babies. And because you're giving a good nutrition and optimal nutrition, so these babies do not have obesity, and therefore in later life, they have less chance of getting early hypertension, diabetes, coronary heart disease, or cancers in later life. What are the advantages to the mother? So first and foremost, it gives an emotional link to the baby. So therefore, there is less chance of having postpartum depression, stress, because as soon as the mother holds the baby, the mother feels very good. There is an emotional attachment or bonding which develops. It secondly, from the physical part, because of the release of oxytocin, it accelerates the involution of the uterus and reduces the chances of postpartum bleeding. It is also an inexpensive way of having contraception, though not perfect, but it can help to delay the next pregnancy. Mothers who have breastfed have lesser chance of both breast and ovarian cancer. In fact, if you interview mothers or ladies who come with breast cancer, the common factor would be either they are not married and they have never breastfed the baby, or in fact, if they have had a baby, they have not breastfed the baby. So breastfeeding is very important. It prevents both breast as well as ovarian cancer. And most important, it reduces the workload of the mother because she doesn't have to spend extra time in preparing the milk and feeding the baby. What about the family and the society? This is an economical way. They don't have to spend money on artificial or formula feeding. If you go to the market now and any brand of formula, whether it's a normal brand or a premium brand, the cost of a tin of powder milk would range somewhere between 500 to 800 rupees per tin. And that would hardly last them a week. So this is the formula or the artificial milk is a very costly affair. With the same amount of money, in fact, the mother can be given good nutrition to produce natural, high quality milk. For the family again and the society, because it prevents future pregnancy. So you help the family in family planning, and it reduces the risk of infections in baby. Therefore, there is a less need for hospitalization. There is less need for economic burden on the family, and it prevents infant morbidity and mortality. Another important aspect in breast milk is the colostrum. So colostrum is the small amounts of thick milk which is produced by the women in the first few days after delivery. And this colostrum, many people used to have the idea that they should throw it off or, not feed the baby. But this is the part of the milk which contains the highest amount of antibodies, white blood cells, and anti-infective proteins as compared to mature milk. And these anti-infective proteins are the ones which are responsible or provide the first dose of immunization against diseases to the baby. So the most common protein which is found in colostrum is a high quantity of IgA. It also has a mild purgative effect. That means it helps to pass the baby to pass out the meconium. And therefore, if the baby is frequently passing meconium, there is less chance of enterohepatic circulation of the bilirubin, and therefore it prevents hyperbilirubinemia in the neonate. I would like to show you this particular picture here, a cartoon which I've made. The upper part which I'm showing you here is the columnar epithelium of the gut in term babies. And you can see these columnar epithelium are closely packed with each other. However, in the preterm baby, the columnar epithelium cells are not closely packed. They have a gap in between. So the preterm's gut becomes more susceptible for bacteria. These are the bacteria. If you just do not feed them, they're exposed, and the bacteria can easily enter the gut between the cells and go into the circulation. But if you give the first feeding to the babies, then what happens? Breast milk, the colostrum contains a lot of mucus along with IgA. So that comes and settles down on the columnar epithelium and forms a thick layer. Next are the living cells, which are the leukocytes. So they come and form another layer on top of the mucous membrane, mucous layer and the immunoglobulin A. And this becomes now a thick barrier, which prevents the bacteria from entering into the through the columnar epithelium into the baby's system. So you remember this cartoon, and this is very easy to explain, and it can, influence mothers to understand why you need to breastfeed the babies. So imagine if you do not breastfeed, this columnar epithelium will be exposed, the bacteria will enter, but if you breastfeed the baby, the colostrum will form this double, triple layer of barrier, which prevents the bacilli from entering. So, what are the recommendations for breastfeeding practices? First and foremost is that we need to breastfeed these babies within the first 30 minutes to 1 hour of birth. So, which means if the baby is being delivered in the labor room or in the cesarean OT, the first breastfeeding should occur on there itself. Second is, do not introduce any prelacteal feeds. So many people still have the habit of giving honey water or ajwain water or such things to the babies, and they should not be given at all. Third is that these babies should be exclusively breastfed for the first 6 months of life. No other feeds should be given. If when you're explaining to the mothers, you have to tell that the breastfeeding has to be carried out both during the day and night. And the night feeding is very, very important, because at night, the body of the baby, the brain releases the growth hormones, and the brain for growth, you need a substrate, that is glucose. So growth hormone will only help if you have a substrate, that is the glucose. And where does the glucose come from? It comes from the breast milk. So this you have to explain to the mothers, that even if they are, disturbed at night, there is a purpose, because the growth occurs maximum during the night time because of the effect of the growth hormone, which is released at night. So at least not only in the day, but more importantly at the night, they have to breastfeed at least 8 times or more per day as per the demand of the baby. And when you are allowing the baby to feed, you have to feed on one breast till the baby stops sucking, releases the breast. And if the baby is still hungry, then ask the mother to offer the other breast. If the baby is not hungry and doesn't want the other breast, then in the next feeding, the feeding should be from the breast which has not been fed before. So in the next session, we tell them to change the breast. The recommendation for breastfeeding practices again say that you have to identify if the mother has been feeding well the baby. So how do you know that the baby is feeding well? They should at least wet the diapers 6 to 8 times per day. That is in 24 hours. The weight gain is at least 20 to 30 grams per day in the first 3 to 4 months after regaining of the birth weight. That means if the birth weight, we all know that in term babies, the weight reduces by 10% and in preterm by 20% of the birth weight. In term babies, the weight gain restarts at 1 week, and in preterm babies at around 14 days. So after that, baby should be gaining at least 20 to 30 grams per day. We will introduce complementary feeding only after 6 months of age. And the breastfeeding is continued up to 2 years of age. A little bit about the anatomy of the breast, where it has 2 sections. One is the glandular tissue and the second is the supporting tissue. So this is the breast. Sometimes you will have to draw and explain to the mothers that there are, these lacteals, or the place where the breast milk is produced, the milk secreting cells, which is influenced by the prolactin hormone. And this milk is produced here by these milk secreting cells. And then they go by the ducts and collect below the areola of the breast. So this brown part is the areola. This is better seen here, the lactiferous sinuses, where the milk collects. So when you have to explain to them about breastfeeding position, you have to tell the mothers that it's not the nipple which will, sucking on the nipple will not give the baby milk. It is the sucking on the areola. So therefore, in the positioning, the baby's mouth should cover maximum part of the areola. So when they suck here on the areola, then only the milk will be ejected from the lactiferous sinuses into the nipple and will go to the baby. So this diagram is useful when you want to explain to them about the breastfeeding position. So what are the reflexes which occur? The first and foremost is the rooting reflex. So as soon as you touch the baby's lips with the mother's nipple, there is a rooting reflex which occurs where the baby will open the mouth wide. And when the baby opens the mouth wide fully, then you ask the mother to introduce the breast into the baby's mouth, because otherwise you cannot force the breast into the baby's mouth. So once the rooting reflex occurs, the mother will put the breast into the baby's mouth, and then the sucking reflex will be initiated, and sucking is followed by swallowing. So any baby who is doing the feeding, if you observe closely, you will see that the baby will suck for a few seconds, pause, swallow, and again start sucking. So this is all coordinated very well after 34 weeks of gestation. And the baby will be doing this, pausing in order to take a breath and to swallow. So how is milk produced? The milk producing hormone is prolactin. I'm sure all of you know it. So P for P, that is for milk production. As soon as the baby sucks on the mother's breast, a signal goes to the pituitary gland, to the anterior pituitary, to release prolactin, which comes down and helps in secretion of the, or expulsion of the breast, production of the breast milk, and oxytocin helps in expulsion of the breast milk. The secretion increases at night by suckling of the baby on the nipple and when the breast is emptied. Prolactin is the hormone which actually suppresses ovulation and thus prevents pregnancy. Then we have the oxytocin hormone, which is responsible for the oxytocin reflex. This hormone helps in milk ejection or output. It is secreted by the posterior pituitary, and the production is helped by suckling of the baby at the breast, the smell and touch of the baby when the mother is calm, relaxed, and stress-free. And sometimes you can induce it by giving a nice relaxing back massage to the mother. So you massage from the spine outwards, and the nerves will get stimulated and the milk production improves. In fact, this oxytocin reflex which occurs is generally expressed by mothers by saying that when I'm feeding from one breast or I look at the baby, my milk starts pouring out of the breast. So this is indicative that there is a good oxytocin hormone produced in that mother. Now, what is correct positioning? When you have to explain the correct position, first is that the baby has to be supported well by the mother. The head, neck, and the body has to be in the single plane. The entire body of the baby faces the mother. The baby's abdomen touches the mother's abdomen. So when somebody asks you to demonstrate the correct positioning for breastfeeding, all these 4 points have to be enumerated upon. So baby's body is all in one plane, well supported by the mother. The baby faces the mother entirely, and the baby's abdomen touches the mother's abdomen. The second important aspect of the positioning and feeding is the correct attachment. So first and foremost, the baby's mouth has to be wide open with the lower lip turned outwards. The baby's chin will touch the mother's breast, and the majority of the areola is inside the baby's mouth. So I have already explained to you that the lactiferous sinuses are below the areola. So if you do a correct attachment, then only the baby will be pressing on the lactiferous sinuses by sucking. And when they suck, then only the milk will be coming into the baby's mouth. Otherwise, what happens? Baby will keep on sucking on the nipple. There will be no milk coming. The baby will get frustrated and fussy, and the mother will land up with a sore nipple. So this correct attachment is very, very important to prevent sore nipples in the mothers, as well as ensure that the baby is getting adequate feeding. So some of the problems which occur during breastfeeding and are commonly expressed by the mothers, first is the inverted and the flat nipples. So we do see flat nipples and inverted nipples in our day-to-day practice, and it really causes a lot of difficulty in attachment of the baby because the baby doesn't have a nipple to hold on or to, to have a grip. So this should be actually detected in the antenatal period, ideally in the 3rd trimester of pregnancy. And they become a problem when it is not corrected. And sore nipple, as I told you, have already explained, occurs because of incorrect attachment of the baby to the breast. If you frequently, there are many mothers who are very finicky about hygiene and they keep on washing the breast with soap. So if you wash the breast with soap, it causes dryness. And once dryness occurs, the cracked nipples will occur or sore nipple will occur. And third is candida infection of the nipple. So there are parents or mothers who give mixed feeding, bottle feeding and breastfeeding. And many a times you'll find that when you bottle feed babies, the babies will get candida, oral candidiasis, and the same will be transmitted to the mother, and they will get candida infection of the nipple. Very painful, and then they will not be able to breastfeed. So whenever we are treating oral candidiasis, we have to take a history whether the mother is giving bottle feeding or not. That has to be stopped immediately. Secondly, when you're asking the mother to apply the cotrimazole mouth paint or the candid mouth paint inside the baby's mouth, the same should also be applied on the nipple. Otherwise, if it stays, the candida remains in the nipple, it will again reinfect the baby. So breast engorgement is another problem which occurs during breastfeeding. This occurs because there is a lot of milk production by 2nd to 3rd day of delivery, and the baby may not be feeding that well, or the baby may not be in a correct position. And so milk accumulates in the alveoli of the breast, and it causes the breast to become very hard, swollen, and tender. And if you do not take care of it, then it ultimately progresses to become a breast abscess because of blocked duct or mastitis. And in this case, the mother will have very high-grade fever, raised blood counts, and you may sometimes have to drain the abscess. And they will be needed to be put on antibiotics. So to prevent this, one is the correct positioning of the breast, of the baby on the breast, along with good attachment. If in spite of that breast engorgement occurs, we need to identify during our postnatal rounds, examine the mother's breast, and then help them to overcome it by giving hot fermentation and massage and expressing out this extra milk which is accumulated inside the breast. So this is a very important point which, as students, you have to go and check in the postnatal ward. The 5th problem, which is very commonly expressed by mothers, is the reduced milk supply or not having enough milk. Sometimes it is correct problem which is identified by the mother, but sometimes it is just a feeling that they have. So how do you explain to them? If you look at the baby, if the baby is well and gaining weight adequately at 20 to 30 grams per day, then you just need to, and passing urine at least 6 to 8 times in 24 hours, and sleeping well for 2 to 3 hours after feeding, then you have to just reassure the mother that your breast milk output is fine. But in case it is not true, then you have to find out what is the cause of not having enough milk. First and foremost, it could be that you're not breastfeeding enough. So if you're not breastfeeding enough, your prolactin and oxytocin is not being produced in adequate amount. Second is you're giving feeds very hurriedly or for a very short time. So baby is not getting enough milk. Poor attachment, poor oxytocin reflex, and breast engorgement or mastitis. So in a painful breast, mother will not want to breastfeed. So we need to identify all these during our postnatal rounds. If there is engorgement, then we can express breast milk out, and either that can be done manually, where from the top to the center, from the periphery to the center, we ask them to massage the breast in a kneading, like when you make atta, you knead. So in that movement, they can do it, or they can use a syringe. So this, I think all of you know that we take a big syringe, say around 10 or 20 ml, cut the part where the needle is attached, take out the plunger and insert it from the cut part. So the smooth part of the syringe is now attached to the breast, and then you can pull the plunger gently. Now this has to be done gently because otherwise it is very, very painful. And the size of the syringe should be chosen according to the size of the nipple so that it doesn't hurt the mother. These days, you also have breast pumps which can be used, but that is another costly affair. So if the unit has a breast pump, it is well and good. Otherwise, a syringing technique is good enough to express the breast milk. Now, in preterm babies, then low birth weight babies, it is difficult for the baby sometimes to breastfeed because, as I said, the coordination usually has to occur between the sucking, swallowing, and breathing. And that develops in utero at around 32 to 35 weeks. So, in fact, if the baby is around 34 weeks gestation plus, we can allow them to breastfeed directly. In preterm babies, as I've already said before, there is a unique composition of preterm milk. It is higher in protein as well as calorie and in antibodies and living cells because these preterm babies need more protection than term babies. Mothers should begin milk expression within 6 hours of delivery. So if there is a preterm delivery which has occurred and the baby is with the mother, fine. But if the baby is not with the mother and the baby has kept in the NICU for any reason, then even these babies should be given express breast milk, and that milk can be expressed within the first 6 hours of delivery. And you repeat at every 2 to 3 hours so that you can bring whatever 1 ml, 2 ml of colostrum or milk is produced, that is brought and given to the baby. And this also helps, the expression helps for the mother to maintain the production of milk. We always encourage these mothers to come and visit, touch, and care for the baby in the NICU as often as possible because this touching and seeing the baby also helps to initiate lactation. Put the baby to the breast every 2 to 3 hours for those who are feeding, and those who are not feeding, then what we do is we give the feed and then allow them to just suck on the breast, which is known as non-nutritive sucking. Non-nutritive sucking helps to also to release the oxytocin and the prolactin. How do you express and store milk? So expression of milk is required in those babies who are premature, low birth weight, sick, who cannot directly breastfeed for any reasons, or the mothers are working, they have to go back to work, or to relieve engorgement, as I've already told you. Now, this expressed breast milk is to be collected in a steel bowl because steel is inert. If you collect it in a glass material, then the cells which are there in the milk gets attached to the neutrophils and all, they get attached to the glass. So that is again not, the baby will not get the neutrophils. But if you use an inert material like steel, it has two advantages because it is inert. So none of the constituents of the milk will get stuck to it. Secondly, it is easy to sterilize. You can boil in boiling water for at least 10 minutes, and that can help to sterilize, is more than enough to sterilize the bowl. And this EBM can be kept covered in the steel bowl and at room temperature for about 6 to 8 hours and in the refrigerator for about 24 hours. Most of the mothers will ask you a question that when we put it in the refrigerator, it becomes cold. So should we boil it after taking out before feeding? The answer to that is no. You tell the mothers that you cannot boil the milk because if you boil, all the immunoglobulins, the living cells which are there in the milk will be destroyed. So what you do is if you want to feed the express milk, then you take it out of the fridge at least half an hour to 1 hour before feeding. Keep it outside, let it come to room temperature, and then you can feed the baby with the expressed breast milk. The second way is that you can take a little warm water in a bigger bowl, and the milk you can take in a smaller bowl and keep it on top of that water for a few minutes. And then when the temperature increases, then you can feed the same to the baby by spoon. So what are the 10 steps to successful breastfeeding? First is the hospital policy should be as such that they encourage breastfeeding. So that is a baby-friendly hospital initiative. So hospitals which are baby-friendly, they do not promote the infant formulas, bottles, or teats. They make breastfeeding practice a standard practice in the hospital, and they keep track of everybody who's breastfeeding. In fact, nowadays we have to report that the baby has been, the initiation of breastfeeding has occurred within the first 1 hour of life. The staff should be competent. So for the staff to be competent, they have to have enough knowledge about the anatomy, the physiology of the breast, the physiology of milk production, and also the correct position and attachment of the baby. So once the staff and the doctors are aware of these, like we have discussed today, then only you will be able to explain it to the mothers. Third is good antenatal care. So hospitals who support mothers to breastfeed, they discuss about breastfeeding in the antenatal period only. And if you're very, very good, then you will also check the breast of the mother before delivery and detect an inverted or a flat nipple and help to overcome that so that the baby does not suffer after delivery. Care after birth should be such that the hospitals support mothers to breastfeed. In fact, the hospital where I work, we have special breast lactation counselors who go and help these mothers to breastfeed the baby during their hospital stay. So first and foremost is immediately after delivery, within the first half an hour, the baby should be breastfed. And later on, the staff will go and help the mothers to breastfeed every 2 to 3 hours in the first few days. Then support mothers with breastfeeding. So if any mother is working or not able to breastfeed, then we need to support them. Sixth is supplementing. So you need to give breast milk to the baby unless there is some medical contraindication, if the mother is on chemo or antithyroid, then it's a different thing. Then you can also help to get a breast milk from other mothers and feed the baby. Seventh is rooming in. So when we were students, they used to have these baby cribs, but now the baby cribs are no longer there because if you keep the baby with the mother, breastfeeding improves, the baby is kept warm, there's less chance of hypothermia, and the mother's lactation will be better. So we need to have the baby with the mother day and night. Responsive feeding, that means breastfeed only when the baby is hungry. So we need to teach them the cues of breastfeeding. So when the baby is rooting or trying to suck its own finger, we know that this baby is ready for feeding. All such things like bottles, teats, and pacifiers are not to be kept in any hospital or the pharmacy. If you see somebody using them, we must explain that these are unhygienic practices, will lead to more infection in the babies, and therefore they should not be encouraged. And whenever we are discharging these mothers, we refer the mothers to the community support system or the ASHA, who will again help them at home to continue with breastfeeding. So the 10 steps to successful breastfeeding as given by WHO and UNICEF are: comply fully with the International Code of Marketing of Breast Milk Substitutes and the relevant World Health Assembly resolutions. So here, there is in India, we have an Infant Milk Substitute Act, which is a very strict act, which discourages us from giving artificial feeding or even using bottle. If you do not comply with it, or you land up writing a artificial powder milk for any baby, you are liable to be arrested, pay a fine of at least 10,000 rupees and kept in the jail for at least 6 months or both. So please remember this, that we are all governed by the IMS Act, and you should read the IMS Act fully so you do not make a mistake. Have a written infant feeding policy that is routinely communicated to the staff and parents, and establish an ongoing monitoring and data management system. So in our state, at least, it has become mandatory that we have to report how many babies have been breastfed within the first 1 hour of life. So that helps to, encouraging all hospitals to follow the uniform policy. Ensure that the staff have sufficient knowledge, competence, and skills to support breastfeeding. So that's the reason why we have discussed this today. And also discuss the importance and management of breastfeeding with the pregnant women and their families. Fourth is facilitate immediate and uninterrupted skin-to-skin contact. Support mothers to initiate breastfeeding as soon as possible after birth. Support mothers to initiate and maintain breastfeeding and manage common difficulties. Do not provide breastfed newborns any foods or fluids other than breast milk unless medically indicated. Enable the mothers and their infants to remain together and to practice rooming in 24 hours a day. In fact, now we have a concept of mother and baby NICU. That means the mothers, it's like a family unit where the mother, if she's in the hospital, will be kept in the same unit. If the baby is being given some CPAP, it can happen next to the mother and or any other supportive care. So it's like rooming in the same complex. So that also helps the babies to remain together for at least every 24 hours. support mothers to recognize and respond to their infant cues for feeding, counsel mothers on the uses and risk of feeding bottles, teats, and pacifiers, and coordinate the discharge so that parents and their infants have timely access to ongoing support and care. So under the National Health Mission, lactation management centers are established at 3 levels in the country to provide support to the breastfeeding mothers. These are the first is the Comprehensive Lactation Management Center, second is a Lactation Management Unit, and third is the Lactation Support Unit. So the Comprehensive Lactation Management Centers are in the phase 1 are to be established or are being established in all the medical colleges with an ICU. And in phase 2, they will also be done in the district hospitals. The lactation management units are now currently in the district hospitals or the large subdivisional hospital with a functional SNCU. The lactation units, support units are at all delivery points. So what are the facilities provided in the Comprehensive Lactation Management Center? At the premier tertiary or referral health facility, it provides comprehensive lactation support and management for all mothers within the hospital. It facilitates for collection, screening, processing, storage, dispensing of donor milk, human milk for other babies who do not have access to their own mother's milk, and facilities for expression and storage of mother's own breast milk by her baby. So human milk, breast milk banks are now being established. We in fact have 2 or 3 in our state as of now. Then lactation management units at secondary level health facility like district hospital with SNCU. They provide the lactation support, collection, storage, and dispensing of mother's own milk for her own baby. So in the Comprehensive Lactation Management Center, you have mother's milk for other babies also. But in the lactation management unit, it is mother's own milk for her own baby. And in the lactation support unit, these are at the lower, the periphery, the sub-district community health or the primary health centers, where you provide basic lactation support by encouraging the correct position, the correct attachment, and frequently encouraging them to breastfeed. So thank you very much. I think that is all for today. And if there are any questions, we will be handling that. So have any questions come, Momita?
Yes, ma'am. Just allow me a moment. I'm checking.
Hello, sir.
Yes, ma'am. Ma'am, I have checked, but I haven't received any further questions, ma'am. I think it was really understandable to all the delegates. And I'm checking once again. No, ma'am. No questions are there.
Okay. So thank you very much for having me here. I think
Thank you so very much, ma'am, for the comprehensive talk. Thank you so much, ma'am. So, ma'am, now with all your permission, I'm closing the session here for today and looking forward to hosting you again. Thank you so much, ma'am. Good night.